So what we're going to talk about today is the thing I promised we would talk about in this video. And right off the bat, you'll have to forgive me if I do have to look at notes more than I normally would. I don't really write these in advance, and I just sort of go with information I know that I have sources to back up. In this instance, there is, in fact, so much information that I cannot do that in sort of the time frame I set for myself. So instead, I've got notes in front of me here on my screen, and on occasion, I will look at those notes to make sure I'm on track and keeping up with where I should be. And so I want to start this video with a quick definition, a historical definition, and that is for the word decimation. So as the name might suggest with the prefix deci, what it meant was that you would destroy 1 out of every 10 of a group of people as punishment for the whole group, right? So that's where decimation came from. That's its origin. Now, it generally just means the destruction of a large group or population, more widespread destruction. But when we say that HHS has been decimated by the cuts that were begun prior to April 1st, but then accelerated on April 1st, decimation, even in the historical sense, is insufficient for the amount of damage done. There is a large portion of HHS that is now gone. And we're going to talk about, as best we can, what those portions are, what they did, what they were responsible for, and really what we, as the American people, are now going to have to deal with as a result. I think it's really important to frame this conversation right out of the gate in a way that is different than from what most people think about, or the way most people think about the thing when we're talking about government spending. So, the very first thing that you have to have a baseline on is that government is not a business. It was never intended to be a profit-generating entity. That's not what it's for. In its most fundamental roots, government is the way in which we as a society handle our disagreements and we implement the will of society at large. But when you're talking about government as a business, it's specifically around generating profit. And so it is important to note that government is not there to generate profit. It is a service. So when people say that the post office loses X amount of money each year, it's not losing money. The post office is a service that we pay for. It's a thing we all agreed to pay for because it benefits us as a society and as individuals. And so it's important to note that HHS, Health and Human Services, is a service. It is a thing we have all decided is good for society and good for us specifically. And it is a thing we will do. It's a fee that we will pay in order to get advances in medicine and in science and in health across the board. And so it's a service. It is not a business. So let's start with the general scope of the cuts. At present, out of about 62,000 employees across all of HHS, 20,000 were cut up to and including this round of RIFs, or reductions in force. That is 10,000 who were removed entirely, and another 10 that were retiring early, took incentives, things like that. People who quit. So that second 10,000 is not necessarily people who were forced out, but does include those people who decided to leave of their own volition because things are bad. However, that does also include people who had normally, in the normal course of their employment, in the normal course of their job, had already decided that they would be leaving. So 20,000 total out of the 62,000 employees. Much more than a decimation. That is a full third. And what's important to note is that RFK Jr., our Secretary of Health and Human Services, has said that the plan with DOGE was to cut about 80% of the people at HHS. And we'll follow up on that quote because there's a second part, but we'll follow up on that in a minute. But first, I want to lay this disaster at the feet of the people who are orchestrating it. I want to talk about them briefly, And then I also want to talk about what their aims are in their destruction of HHS. So, our first one is obviously Donald Trump. Donald Trump, having been described as some mix of malice and incompetence, has a long-standing grudge against HHS from his first administration. Now, we know that COVID really hurt his reelection. We know that he often disagreed with public health officials and didn't really want to acknowledge the pandemic in the first place. And because of that, and because of the perceived effects of COVID on his economy, which was not his economy, to be clear, that was Biden's economy, but COVID, because of those effects, hurt him politically. And his retribution would be in the dismantling of that organization, of that institution, and the pieces of it when he returned to office. So that's his motivation. The second person is, of course, our Secretary of Health and Human Services, RFK Jr. RFK Jr. is what would happen if the trying not to cough in class meme guy immediately aged 120 years. And he sounds like if that guy aged 120 years immediately while trying not to cough. Now, his motivation is twofold. There's a profit motive in it for him because he is a staunch anti-vaxxer, has been, will be, and he sells merch around that. He has interest in that. He has financial interests in the companies he's sued on behalf of people. And that's his motivation. It's financial. It's also probably something he deeply believes, even though all the evidence points to the contrary, that he thinks that science is some sort of large cabal of people who can all agree, and because we can all agree in science, then we just do things for our own profit motive. Now, all of this ignores the fact that scientists, by and large, are not that wealthy. I've known plenty. Not many of them are doing great. And what's more, he seems to think that scientists can agree on things, but get 6 people with PhDs in the biological sciences in a room and ask them to pronounce this word. Because there are 2 very differing schools of thought on how that should be pronounced, and we as scientists can't even agree on that. Even if we get a linguist involved, doesn't really matter. So, no, scientists couldn't all agree on some sort of large conspiracy or lie, because that's just not a thing, right? It couldn't be. How could all of these people possibly keep that sort of secret for so long and only have, 1 or 2 dissenters who can't even say that science is a cabal, but just sort of say that people don't listen to them? So that's our second person. Let's talk about the third person involved in this. And this is his name you've likely not heard, but this man is Roger Severino. Now, good old Raj was the author of the HHS portion of Project 2025. That was his contribution. And now you're wondering, okay, so what did this guy do? What was his qualification to look at HHS and say, this is the thing we need to break down, and here's how we rebuild it to make it better, to make it stronger? What does this man who laid the blueprint for this, what does he have in terms of qualifications? And I'll tell you, he's a lawyer. He's a lawyer. And interestingly, during Trump's first term, since a lot of the underfill in his current administration comes from people who worked for him the first time in different roles, his role in the first term was that he was the director of the Office of Civil Rights at HHS. One of his crowning achievements is that he removed the provision from the ACA that prevented healthcare providers from denying care to people based on the patient's sexuality or gender identity. Seen here, a picture of Mr. Severino looking like just disappointment. I haven't found a better way to describe him, but I do think it fits. Now, his motivation, to be clear, I really don't know. There's not a lot on him. He just seems sort of like a person who was thrust into the position. And it's important to note that he was initially with the Department of Justice, I believe, and after that just got shuffled to that office at HHS. And that appears to be the total sum of his qualification to have written that section of Project 2025 and present the blueprint that we're now seeing. So, that earlier quote from RFK Jr., we're going to revisit it right now. So he initially said that the plan was for Doge to come in and together they would cut some 80% of HHS, and then they will have to reinstate 20% when they've sort of realized that those people were important and what they did was important. He says that was the plan. Now, interestingly enough, as we've seen with sort of the administration, the regime's pattern of firing people who are important and then trying to walk that back and rehire them, that was bound to happen. And it happened at HHS too. Happened at the FDA, happened at the CDC, happened at the NIH, and all of that, RFK said, no, that was a mistake. We didn't mean to do that. We're going to hire them back. Now, when asked about this, spokespeople at the Department of Health and Human Services said there was no plan for large-scale rehiring of people who got fired. And if some 20% of the 20,000 people who are gone were, let's be generous, if some 20% of the 10,000 people who are gone are needing to be rehired, that's 2,000 people. You can't rehire those one by one with no sort of large-scale plan that'll take forever, because there's a lot of work that goes into hiring a government employee, even rehiring. And so he probably just fucking lied about that, made something up, doesn't really have a plan for it, just seems to be shooting off the hip. And all of that leads us into talking about the actual cuts. I want to talk broadly about where the numbers are coming from for different things, but I want to stress something before I start. As with all of those people deported to El Salvador, the government hasn't actually issued any guidance or press release or list or any sort of communication on what was actually cut. A few things here or there have been mentioned, but there's no master list of the 20,000 people who are gone and what programs are impacted. So, while there has been independent journalistic reporting on programs here or there or somewhere else that have been cut or pared to the bone, there's no master list. So I'll be relying on those individual reports, but also relying on some self-reporting that has occurred. So this blog, this Substack, Your Local Epidemiologist, has actually been a really good source on this. And they have a document that has been used in a collaborative fashion by people who were let go to talk about specifically where they worked, what they were doing, and what other parts of the government around them were shredded in this mass firing. Now, I also want to talk about two things really quick before we get into that. First, I just want to say the absolute, inhumanity, the absolute lack of morality around firing a bunch of people and then saying, oh, that might have been a mistake, we'll hire them back now, is absurd. You've uprooted someone's life, you've caused them no small amount of grief or hardship or heartache, you have broken a trust with them, and now you expect them to come back. And that is, to say the least, pretty fucked up, right? It's not okay to do that. And you can't guarantee those people will be available to work for you again, because they might have found something else. Especially by the time you figure out who they were, how to contact them, and then actually reach out, they might already have found something, because believe it or not, people do need jobs. Most people do need jobs to continue to live in this country. Now, RFK doesn't, because he makes his money selling anti-vax merch and suing companies, or on occasion the government. So he doesn't need that, but other people do need jobs, and so they will be gone. The second thing that I wanted to say before we get into the numbers and to the detail is that it is such a fucked up thing to do before you've had any experience about what's going on, to go in and say, yes, I who've never been involved in government, I who am not a scientist nor am I a doctor, have such a good understanding of these programs and the way things function that I know that I can slash 60% to a final amount in that portion of government. And I will say that 62,000 people seems like a lot of employees until you consider that they are 62,000 people spread across the country who are responsible for all of the other 300 plus million people in the country. They're a vanishingly small percentage. I mean, they're what? Not 1% because that'd be 3 million. Not 0.1% because that would be 300,000. So 0.02% of the population of the country. And you want to inflict harm upon them, damage upon them, when you've no clue what they do. It's ideological and it's a problem. Let's start with the CDC, which lost about 2,400 jobs. That is, and represents approximately 42% of the Centers for Disease Control. There are a lot of places that I will not list for the sake of time and brevity, but it is important to note that generally across the board, in every part of HHS, where we have seen the most drastic cuts are in offices of management and offices of communication. So the way that these institutes or centers are run and the way they communicate to the outside world about what they're doing. These have been cut. Services for FOIA requests, gone. And that's just sort of across the board. But when we're talking about the CDC, we are talking about, and this list will be groups that have effectively been gutted and are non-functional due to the amount of personnel that were removed. You have the Global Health Center, which works to focus on diseases and to focus on health challenges that affect not just the US, but the world and our interactions with it. You've got the Center for Environmental Health, which talks about things like pollution in the air and the water and how that affects everyone in this country. Center for Immunization and Respiratory Diseases, gone. National Institute for Occupational Safety and Health, gone. Center for Birth Defects and Developmental Disabilities, gone. The National Center for Chronic Disease Prevention and Health Promotion, gone. Keep in mind, one of the big things that they're sort of touting is, well, we got to focus on America's chronic disease problem. So we're going to eliminate the office that was doing that. The National Center for HIV, Viral Hepatitis, STD, and Tuberculosis Prevention, the National Center for Injury Prevention and Control, Maternal and Child Health Bureau, and the Office of Health Equity. You can see why that one got cut, though, because they had equity in there somewhere. That'll fuck you up real good, real quick. The Admin for Children and Families, gone. Then we're going to look at NIH. So that lost some 1,200 jobs. That lost full functionality in the Division of Clinical and Healthcare Research Policy, the National Institutes of Allergy and Infectious Diseases. That was one of the two wings that Anthony Fauci was in charge of, so of course that's gone. Also, they do vaccine stuff, so gone. The Division of AIDS, gone. Division of Microbiology and Infectious Diseases, where is it? It's gone. The Institute on Drug Abuse, I know we have this whole fentanyl problem, and that's why we're sort of lying about Canada to tariff them from a fentanyl emergency, but we got rid of that Institute on Drug Abuse. And then the Institute on Neurological Disorders. Then we've got the FDA that lost some 3,500 jobs, essentially wiping out the Center for Tobacco Products, the VRB PAC, or the Vaccines and Related Biological Products Advisory Committee, the Agency for Healthcare Research and Quality, Health Services and Value Research, the Center for Veterinary Medicine, gutted, Office of Investigation and Inspection, Oversight can't be there, so you gotta gut that one, right? Then you've got the newly minted Human Foods Program, which was supposed to sort of centralize the functions of the FDA in relation to the food regulatory environment to make our food safer, but we got rid of that. One thing I do want to call out specifically here is an interview by the former head of the division focusing on vaccines in the FDA, Dr. Peter Marks, who talked about not just the fact that that division focused on vaccination generally, making sure they're safe, making sure they're effective, testing them, finding out how to deal with them, how to roll them out. But he also mentions that that part of that group's responsibility was around biowarfare and how to counter bioweapons. So that's gone. And it's important to note that a lot of big names, it's not just that they've been let go, but they do this neat little administrative trick whereby you reassign someone who lives in, say, Virginia or Atlanta to somewhere in Nebraska or Wyoming. And if they don't take that, well, then you didn't fire them, they quit. And so that's how they get rid of people who would have been harder to get rid of. Then you have the Centers for Medicare and Medicaid Services, CMS, that lost 300 jobs. These were mainly around minority health and ops and local engagement. So right there, that's around 7,400 of those 10,000 jobs, taken largely from the FDA, from the CDC, and from the NIH. It is a bloodbath. What I will note is that because the data has been self-reported on that document, which is, of course, linked in the description like every source I use, because of that, it is difficult to get exact numbers, and because we aren't getting the information from the government. I will say that I have checked, or I had checked previously with a couple of people at the FDA, and some of the specific things that I checked out. I didn't check everything, but there were things that were not widely reported that were in that document that were in fact done. So I tend to trust the validity of it because it is the best source we have. Now, I am making this video on Friday, April 11th, and so there are some things that I normally make these on Wednesday, but this sort of couldn't happen this week, and so it plays a little bit into some extra stuff I have here on the end. So first is that all of these cuts, which are in and of themselves devastating, which will make each and every one of us in this country less safe and less healthy, all of these cuts that are supposed to make America healthy again that will hurt us, are in addition to the almost 800 research projects that have had their funding cut, pulled, or stopped since this administration came in. And it's important to note that the NIH has been the single biggest funder of science on this earth. And so much of that healthcare spending pays back in dividends. So much of that spending for research and science produces more economic output than the money we put in. So if you're talking about it from a business standpoint, which again, you shouldn't, but if someone is, you can just bring up the fact that depending on the section of HHS that you're talking about, it can bring in a varying range of benefit. As you can see in this graph, there are different levels. Some of them are quite a good return on investment. And overall, federal funding for science is a great return on investment. Not as high as the IRS, but it's good. So even though it's not supposed to be a business, it is in fact helping the economy. Some of you will know that there was another cabinet meeting yesterday, and as much as I cannot stand to listen to Trump or to listen to the people around him heap him with praise for doing nothing, but they claim he's God's gift to America and that he's so great and that it's his leadership and his energy and his momentum and his, I don't know, say anything you want about him. It's his height. All of these great things make him so great. And I can't stand to hear him talk or hear them praise him for shit he hasn't done. Tangent, gone now. But during that cabinet meeting, RFK Jr. said he wanted and was going to have Health and Human Services determine the cause of autism by September. I don't know if I have to tell you this since you are watching my video and I have so very few viewers, but I feel like you probably agree with me. If you don't, by all means, get in the comments. We can talk it out. But RFK Jr. is a fucking idiot. I mean, Jesus Christ. He says that he will get the HHS, which he has just gutted, lost a third of its workforce. He will get them, those traumatized, overworked, underfunded, constantly afraid for their jobs people, he'll get them to determine the cause of autism by September. Never mind that research has been going on for years, for decades, about what the causes of autism might be. It's a neurodevelopmental disorder. Those are really hard to track down because, as it turns out, you don't get to dissect a lot of brains. So it makes it hard to follow those pathways. And even if you could, doesn't mean that it's not some sort of physiological thing that you couldn't determine from a cadaver that you would need a live patient to determine. So it's not easy. People have been working on it. Now, he clearly doesn't understand science if he thinks that you can just will progress in happening in a number of months. But I bet you right now, they actually will find something. Truly, I believe that they'll put out some report, they'll have an answer. I already know that answer. I already know what's going to be on the report, and I can tell you how I know that. I know that because the person he tapped to lead this task force or study or this endeavor, one Mr. David Geyer. I'm not sure if I'm pronouncing that right, but I don't care. So good old Dave, not a doctor, not a scientist, maybe a lawyer, but I don't even think he's a lawyer. Now, Dave's dad has had his medical license pulled in, I believe, every state he's practiced in, and that is because he has routinely attempted to link autism to vaccinations, going so far as to lie and gain access to different governmental interfaces in order to try and misconstrue data. Good old Dave has been a proponent of vaccines cause autism forever. So if you put him in charge and you strip away every bit of guardrail and the offices that talk about ethics or the responsibility of research or offices that evaluate things that are done to be sure that it comports with good science and good governance, then you can just put out whatever you want. So, while I know they won't figure out what causes autism, I can almost bet, hell, I'd put money down on it, that when that report does come out by September, it's going to say that it was vaccines. And it's going to be a lie. And I can't tell you exactly how they'll make it a lie. Right? Because there are lots of flavors of ways to manipulate data or to conflate correlation with causation, but they'll do something. And when that report eventually does come out, I'll talk about it. But that's what his aim is for that. And finally, I talked briefly about each of these three jackasses and what their motivations might have been in attacking science as vehemently as they've done. But there's some overarching things that I think also factor in. First is that science is the method by which we understand the world around us and we quantify the effects of things. It is the objective viewing of the world through the lens of data. And if you want to be able to sell lies, then you've got to get rid of that. And so one of the knock-on effects of doing all this cutting and all this rearranging and all this political mangling of our health agencies is that you can control data now. You can pretend, you can lie, and there's no one there to fact check you, and there's no basis of fact or no data-based option to prove that you were wrong. You also have the fact that this gutting provides heavy control to the government over universities who receive science funding and over private companies who both utilize government funding when available and utilize the research generated by government funding in order to advance things. None of what they are doing will help us. I want to be clear. RFK Jr. might have some good ideas, but it's very likely that he got to them the wrong way. And what's more, his intent is to dismantle these things because he can, because of some perceived grudge. The man who is responsible for so many children dying, the man who has now overseen a second child death to measles in Texas, who has seen the largest measles outbreak in decades in the United States, who's overseen that, and who pats himself on the back for doing a great job. As I've said before, one of our greatest strengths as a country has always been the science we can produce. We lead the world in that. There is no dispute. And while this country is not the best at everything, it is the best at science, or at least it was. But we are increasingly seeing that our best scientists will leave. We are seeing that we are going to be made weaker by all of this. I find it hard to express in a healthy manner the rage that this administration fills me with almost daily, from the way they lie as easily as some people breathe, from the way they distort facts, from the callous cruelty with which they treat the lives of people, not just in this country, but around the world, from their total unwillingness to have any sort of moral basis for anything, and their absolute laser focus on attaining power and money. From the bullshit insider trading, the tariff nonsense, from every bit of the absolute trash that they heap on the rest of us. It is so hard to maintain composure when talking about these things. But when we talk about science, and when we talk about what they're doing there, this is not a thing, much like a lot of other things they're doing, this is not a thing we can reverse easily. When studies and grants are broken down or removed or stopped, samples or cell lines or animal models cannot be maintained. And studies, especially in humans, that might have taken years to get to a point where we can get usable data out of them, are gone. And so the best you can hope is that you can restart that study later, but you cannot continue it now because you've missed time points, because you don't have people you're testing, because you're missing variables, because you don't have staff to do any of it. And what's more, all of this is done not by a single fucking scientist. This is being led by 2 lawyers and a trust fund baby. People who wouldn't know work if it bit them in the ass. People who don't understand how science works and would rather tear it down just because they don't like it. There is so much wrong with this regime, and there is so much they are doing bad. This is a thing, again, that I can focus a little bit in on. This is a thing that is important to note. All of the things that we are losing because of this. We have lost programs around HIV prevention, asthma and air quality, environmental hazard responses, gun violence prevention, worker safety, reproductive health, birth defects, disability health, TB prevention, blood disorders, surveys on drug use and mental health, lead poisoning prevention, water safety, and the entire tobacco control division. We have lost branches that have done amazing things in combating a number of challenges we face that do take time to do their work. Any scientist will tell you that science is not a fast process. You can't go fast and break things. You need repetition. You need a good design. When you're working with animals or humans, you have to have institutional validations and board checks to make sure you're doing everything ethically. All of this takes time and provides benefit over time. There's a reason that we are dominant in this world, and it is because of science. And we are losing that. And in the same way, we are burning our credibility with this tariff bullshit. We are burning our goodwill and soft power with the USAID cuts. And that is the same way that we are losing our intellectual edge with these attacks on science in this country. And so we get to the part of the video where I normally tell you what you can do about this, where I tell you how to fight back on this. And I hate to say that there's really nothing you can do right now, except what we have to do for everything. You can try to call your representatives, but they don't really have power to deal with this. You could try to call Trump, but unless you're a billionaire, he won't answer, and the White House probably just shreds notes anyway that don't start with, "Mr. President, sir, thank you so much. I love the fact that you are so tall, so fit, so strong." So, we do what we can. We protest, we bring light to the darkness that they are trying to shroud these cuts in. And we ensure that when the time comes to vote, we vote. It does not matter. I am in a red state. I drag my ass to the polls. Every time. You need to do that too. And they're trying to make it harder to vote. And if they want you to not vote so badly, there must be a reason. We all have to stand up for something. We all have to look at a vision of the world we want and the world we have and try and figure out what matters. I can tell you this matters. I can tell you that remembering these things have happened matters. Because we cannot forget this. We cannot forget what we are losing. We can't forget to rebuild these things if we get a chance, when we get a chance. But to build them better, to build them stronger, to not just fix what they've broken, but to fix what was already broken. To fix the parts of the system that didn't work well, or didn't work fast enough, or were not lean enough. To fix the parts that are important, that have been overlooked. But you don't burn down the house you're in when you haven't built a new one. And that's what they're doing. One additional thing that I wanted to talk about before we go. During that same cabinet meeting, Elon was talking, and I was debating whether or not I should deafen myself so that I never have to hear his voice again. But he did say something so incredibly stupid that I do want to point it out. He was talking about going through unemployment insurance. And how, and I'm quoting, there are people who've not even been born yet who were getting unemployment payments. I cannot stress enough how stupid that is. I can't stress enough how little sense that makes. So you're telling me there are people who haven't been born yet who are somehow getting unemployment insurance. I can debunk that right now with one question. What are their names, Elon? What are the names of those people who haven't been born yet that are getting unemployment? Because it seems to me that they really don't issue like a birth certificate or any way to have a name that you could put on a form until you've been born. Right? When you get your birth certificate that has your name on it. It's also when you get your social security card. Also has a name. Again, these things don't happen before you're born. They happen when you're born. So either he's lying there, or, as he has done in the past, he has seen something that he doesn't understand and has taken the wild jump that means that something absolutely unrealistic and implausible is happening. So, when you hear this claim repeated, which I'm sure you will, just ask, what were their names? Because again, if you haven't been born, you don't have a name. And every government form I've ever filled out has required at least my name somewhere. Every form I've filled out has required my name somewhere. My date of birth somewhere. And do you think that it's so easy to get unemployment that you can just write bullshit on the form and get unemployment? They've made it so difficult to get unemployment that most states, people give up before they get it. I will say, watching that video of Elon getting trolled while playing his game on his private jet gives me life. And with so much bad shit happening right now, it is really important that we get those moments of joy. Like watching people spam his chat over and over and over again saying, Grimes never loved you. I wish nothing but ridicule and loneliness on that man. I hope he never has another true connection in his life. I hope Every day he realizes just how much people generally dislike him. And I hope he lives a very long life with those feelings, because I don't know if even his time on this earth, even if the oldest of us who could possibly live would have quite enough time to endure the ridicule he deserves. I think when it comes to someone like RFK Jr., he is a zealot who believes something that is not true, and for whatever reason he believes it, he will carry that on. He will sell out all of his values in order to meet the end he wants most. He has come into this with his presupposition of the problems and what the results should be, and he is like a bad scientist, like a person who would have been drummed out of the profession. He is starting with his conclusion and then working his way backwards. He is not testing it, he is fishing for the thing he wants, and he will manipulate data and he will lie to get that. It's important to remember as we move forward. So much of what we're dealing with is unprecedented in ways that we can't quite see yet. But it's important to note, not a one of us is alone in this. And if those protests last weekend showed us anything, they have shown us that we are not alone. We will not be alone. And that we will not let this country fall to fascism, to fundamentalism, and to hate of others. That there is a strong element here who will stand up for the rights of everyone and for what is good about this country. And it is important for us to remember that. Take care of yourselves. Take care of others. And I will see you again next week.